Hi guys, Dr. Melissa here again. So I just wanted to talk to you guys a little bit about functional medicine. I was planning on talking about acupuncture and acupressure points, but I already touched on that earlier this week. So I just want to give you guys some tips about functional medicine, since these are some things that we're trying to spread the word about in our office to help people. Sorry, closing the window. To help people in ways that they can right now with their health if you're stuck at home. So chiropractic, medicine, if you are not able to or don't want to come into our office right now, which is, understandable, absolutely. That's a little tricky to do from home. We can give you exercises for sure, but that can be a little tricky. But we are working tirelessly to have functional medicine available from home, and it absolutely is. So everything that I'm talking about can be done virtually over the phone. And so if you've ever wanted to dig deeper into the root cause of your issues, now is really the time, because many people do have time, they're at home, and we can do everything over the phone. So what is functional medicine? So functional medicine is basically looking at the root cause of an issue. So we're looking at the root cause of a nutritional deficiency, a gut problem, neurotransmitter, so brain issues, thyroid issues, autoimmune issues, even as far as cancer, things like that. And we're looking again at the root cause. So we see people, let me use the example all the time of migraines. We see it all the time. And we can try our best, to target things musculoskeletally, but at what point do we sometimes say something else is going on here? You might have some severe inflammation going on. You may actually have an underlying autoimmune issue going on. You may have severe gut dysfunction. You might have mold toxicity that you never knew about, things like that. And that's where we come in and we target those, and we do a screening, and we ask you questions, and we have you fill out questionnaires, and we really dig, and we analyze blood work. We use a super affordable blood work portal and center. The blood work is like amazingly cheaper than insurance, and we can really get really dig deep. And then from there, we also can do a ton of functional testing. So what does functional testing mean? So this is different than, let's say you were to go have a, colonoscopy done at your, with your PCP. It's way different than that. Functional medicine testing is looking at things from a different lens. So let's say you come in and you do have some irritable bowel syndrome. You've been told you have that, and you've been kind of just told to live with it. Totally not the case. We do not let people live with irritable bowel syndrome. There's no way. Irritable bowel syndrome to us is just symptoms. So we want to figure out, well, what is actually going wrong inside that is giving you these symptoms. So from there, we would do a stool test, and it's lovely. You can do it from home. It's really simple, and then you mail it in, and we analyze the results for you. And then we give you gentle supplement recommendations, dietary recommendations. We guide you through the changes that are going to be made that really are going to help affect your health overall. And we want to get rid of that IBS for good. And that's our goal. There's so many underlying reasons why gut dysfunction might be off. That's just one example. What about insomnia? Insomnia is another huge one. Again, we can run a test for that. There's actually a test that has to do with your cortisol levels, and we look at your cortisol levels throughout the day and then at night. And if something is a little bit off, then we know that we need to target your cortisol levels at a certain point in the day. So that's another great example. Another one is just general nutrient deficiency. So let's just say you're always feeling just kind of like crap. And let's say we did run some general blood work and things aren't horribly off, but they're, still a little bit weird here and there, but not horribly off. Well, we can do something called a NutriVal test, which manages nutrient absorption in the body. So we can run this lab, and then we can say, okay, you're deficient in B vitamins. You don't have any glutathione, which is an antioxidant. So virtually your liver can't detoxify. So you're building up toxins in your body, which can cause a ton of symptoms. And then from there, we're going to give you specific supplements. So it's better than you just, going to the store and saying, okay, I think I'm going to take vitamin C and vitamin D, and I have no idea what it's going to do for me. You wouldn't believe how many patients we have come in and do that. And it's like, well, why wouldn't you want someone to come in and actually be able to say, hey, this is exactly what you need at this point in time. So that is what is super, super key for us. And we're trying our best, to really make it doable for people. Also, our supplement recommendations, they get shipped to your house. You do it all from home. So literally this all can be done from the comfort of your home. You give us a call. We do a virtual workup. And then we send you with either blood work, like I said, or kits, probably more kits at this point in time that get sent to your house. You do it all at home. You mail it in. We get results, and then we give you a plan. And we don't just let you loose there. We walk you through the plan. We check in with you periodically. We help you with diet changes. We really are thorough because we don't want to just cut you loose too soon and then people don't know what to do. All of these kits that I'm talking about also can be run through insurance, which is great. That's something that our office prides ourselves on, is we try to have it as, financially easy as possible. So you submit it all with your own insurance. Reimbursement rates, aren't up to us. That's up to the insurance company, but you can submit it and it's pretty awesome. And then the visits themselves are going to be through our office. So those are cash visits, but the kits I'm talking about are through insurance. And it's something just awesome. If you're looking for a way to boost your health right now, and you've always had a lingering problem and you don't know what to do about it, then this is perfect for you. If so many people out there say, like, I've always dealt with migraines and I don't know what to do. I've always dealt with bloating and I don't know what to do. Or I've always had pain, fibromyalgia, things like that. Or I've always had thyroid issues, and they're just kind of told, well, that is what it is. Infertility, that's a huge one. That's where we come in and we say, look, we're going to dig and we're going to figure out what's wrong. I'll give you guys a really cool example. So I had a patient last year who was having severe depression and almost getting into like a bipolar presentation. And I did a thorough intake, and I was originally planning on doing a neurotransmitter test, which is a test that is for brain chemistry.